pandemic has put a lot of pressure on the health system, but a group of doctors are teaming up to help. A group of independent doctors in our area are working to provide patients with an environment separate from emergency rooms and COVID-19 treatment places. Joining us more to talk about what the facilities offer is Dr. Shamieh with AVALA Health. Thank you so much for joining us this morning.
Thank you, Sheba. I'm very excited to be here and share the things that we have going on at AVALA.
Yeah, it sounds very exciting and much needed right now. So tell us more about this network you guys are creating.
Sure. So, patient healthcare is very stressful before the onset of COVID, but now with COVID, it's kicked it into high gear. So our goal here at AVALA is to take the stress away from healthcare. And some of the things that we do to provide for that is we have a spa-like environment with cutting-edge technology, including robotics, surgeries for joint replacements, such as knee replacements and hip replacements. We also have robotic surgery for spine surgery. So it's putting the most cutting-edge technology in the hands of our physicians and allowing them to treat patients in a more personalized, individual manner.
Very nice. And during this pandemic, of course, so many people, we've read studies showing people have held back on getting treatment for other issues because they were afraid of going into emergency rooms, doctor's office, and catching COVID there. How are you guys addressing that concern?
So we're kind of lucky. We've had zero cases of COVID in our hospital. We do not have an emergency room. So we've kind of tailored our care to the more boutique surgeries, so that patients can get their elective surgeries, such as plastic surgery, orthopedic surgeries, spine surgeries, eye surgeries, pain procedures, all done in a facility without any cases of COVID. Patients have numerous stories of being scared to go to the emergency department, scared to go to the big hospital systems. So we're providing a little bit of a different avenue for their health care.
Very nice. And then when it comes to insurance and payment for this with a new network of doctors, how does that work?
So we're in network with all insurance carriers. We actually carry costs that are cheaper than the big hospital systems. So you can get the same procedures with high quality and low cost in order to drive down the cost of healthcare, which has been doing nothing but rising over the years.
Yeah, and of course, during this pandemic, the healthcare industry has been so interesting to watch the changes that we've seen during this. Is there anything you've learned during this pandemic that you feel like has changed the healthcare industry forever?
We've certainly had to change our protocols and the way we approach medicine. The main thing that we've done is to reduce the amount of stress surrounding healthcare. So instead of having a high administrative burden and bureaucracy, we put the decision-making into the physician's hands and allow them to make the decisions for themselves and treat patients in the best manner. So what we've done is we've formed an AVALA Physician Network. We're really excited to announce that. Because we're allowing physicians who may be unhappy in the bigger hospital systems to move on over to a smaller, more boutique atmosphere where we're really personalizing patient care and taking care of the patients.
All right, Dr. Shamieh, thank you so much for joining us to tell us about this new network, and hopefully it helps provide even more people with health care. Thank you.
Thank you so much for having me.